them. Next, ethnicity, and this follows pretty close with race. Ethnicity would be your ethnic heritage, your ancestry. We know that we're seeing an increasing number of immigrants coming into our communities. And again, don't let things like accents get in the way of you thinking that maybe someone who has an accent that maybe you can't understand, you don't want to spend as much time with. Or sometimes people think if a person speaks with an accent, they are less intelligent than me. So again, and sometimes even people see someone or hear someone speak with a British accent, they may think that person is more cultural, more advanced, more educated. So be cautious of generalizing too much, again, based on ethnicity. The next category we'd like to look at is disability. It's very important to remember when you're talking about an individual who has a disability that you identify them as such. This is an individual or a person who has a disability as opposed to a disabled person. We need to focus again on the individual. Oftentimes we find ourselves looking at a person with a disability and we decide what they can't do, as opposed to realizing how much skills and talents and potential this person has. Again, a person with a disability will identify for you exactly what their limitations might be. And you need to be conscious that you may need to work with hearing impaired interpreters, you may need to work with people who have physical limitations, and all of those kinds of things will help you develop a better awareness of how to treat that person with dignity and respect. The next area that we'll talk about regarding diversity is sexual orientation. And this category especially sometimes has some very strong moral value or religious concerns regarding it. The most important thing regarding sexual orientation is to realize you may be dealing with a patient or a client who identifies himself as gay, lesbian, bisexual, and what you need to do is, again, treat this person with dignity and respect and provide the best care possible to them. And forget any of the biases or stereotypes or prejudices you might have. Again, it's the quality of care and the sensitivity for the patient. Next, age. As I mentioned before, we have an increasing senior population. Those numbers because, again, the quality of health care, people are living longer, and again, we need to be conscious of a generational issue. People who are older and who have had different experiences than us sometimes have different needs. They have different expectations of how they should be treated. And I think especially with our senior population, the most important thing is to remember patience. The next category is gender. Now, this will be critical especially if you, for example, are a male caregiver providing care to a female or vice versa. Sometimes there might be concerns about privacy, the person feeling somewhat self-conscious about you, a person of the other gender, taking care of them. Again, be conscious and respectful of any nonverbal cues that you might identify that would be a concern. And that should help you deliver care, again, in the best possible way. The next category we'll talk about as well is socioeconomic background. And that means you might be dealing with an individual who's from a different income level than you. They might be someone who is from a very poor background or might be on welfare. Again, remember to treat them with dignity and respect. The other categories that we might sometimes look at when we talk about diversity would be religion. And in these days we have an increasing variety of religious affiliations that we need to be conscious of, especially regarding traditions and certain ways of doing things and their impression of healthcare. And then also another area is geographic. So it might be urban versus rural as far as the geographic location of where that person was raised or where they currently are from. Remember that the goal is to help you provide culturally responsive services. This can be done in 3 ways. First, develop cultural awareness. You must again examine your own biases and prejudices and understand how these impact on your interaction with culturally diverse clients or patients. 2, have cultural knowledge. What do you know about the culture of another person? Oftentimes, this can be obtained through reading or even conversations with that individual. It's okay to ask questions about a person's cultural background, maybe their religious beliefs, even other things about disabilities and any other thing that you might have a concern about. That's the best way to gain your cultural knowledge. And finally, practice cultural skills. It's important to integrate your cultural awareness and your cultural knowledge into your work. It becomes a natural process over time, and again, this really Bottom line, helps you develop culturally responsive service. Finally, I would like to talk about a very important part of developing cultural competence: communication. You must be able to effectively communicate across cultural lines, as I mentioned before. So first, let's talk about some of the barriers to effective cross-cultural communication. First, assumed similarity. Too often we believe that everybody thinks the same, is the same, because a certain person is from a specific group, that they're all going to think alike. And we also think often, and we assume, that the same gesture means the same in the English language in the United States as it would in a European country or an Asian country. Be careful. Oftentimes, gestures and certain phrases have different meanings in different countries. Next, nonverbal communication. They tell us 70% or more of our style of communication is done nonverbally. You need to be conscious of what you look like when you're talking. Are your words matching the way your body language and your gestures, your facial expressions, and your eye contact are making? And oftentimes you need to realize not all cultures are comfortable with eye contact. So you need to be able to effectively communicate again. Next, verbal language. Is your message being understood? Is the person you're caring for clearly understanding what you're saying? Next, don't have the tendency to evaluate. That can be a true barrier. You need to not jump to conclusions or judgments about specific people. You should not dismiss or minimize where a person is at based on the evaluation you have made with them. Again, first impressions do mean a lot, but don't jump to conclusions based on those first impressions. And finally, again, as I've said many times throughout this training, preconceptions about individuals and stereotypes can be a barrier to effectively communicating across cultural lines. Now I think the most important part. Let's talk about some of those strategies to bridging those cross-cultural communication barriers.